Keith Baumgarten from the Orthopedic Institute. I've been practicing here for 19 years. I'm a fellowship-trained shoulder specialist, and I'll be reviewing with you the symptoms and treatment options for rotator cuff pain. This is a special area of interest of mine. Here at the Orthopedic Institute, we've been researching the best ways to treat you when you are having shoulder and rotator cuff pain to achieve the best and fastest way to a pain-free shoulder. This research has resulted in various awards, such as the Neer Award and the Kappa Delta Award, and upwards of 30 research papers, published in journals such as the Journal of Bone and Joint Surgery, American Journal of Sports Medicine, and the Journal of Shoulder and Elbow Surgery. Problems with the rotator cuff are the most common reason why someone develops shoulder pain. This pain may often involve other areas around the shoulder, including the upper arm, the biceps, and the shoulder blade regions. Oftentimes, patients grab this area and say, "Doc, it's not my shoulder, it's here." But this is typical shoulder pain. Rotator cuff pain often is worse at night. It's worse with activity, especially with the arm away from the body, and is often relieved when the elbow is kept close to the body. Problems with the rotator cuff can result in muscular weakness as well. Oftentimes, these symptoms can be temporary and resolve on their own, but at times they can be persistent and require care. If you are having persistent or severe pain, please contact me here at the Orthopedic Institute for an evaluation. Now, although I'm a surgeon and I do enjoy performing surgery, my first goal is always to see if there's a way to get you better in a non-operative fashion without doing surgery. These non-operative options include over-the-counter medicines, such as ibuprofen, naproxen, and Tylenol, rest and activity modification, and physical therapy, which can be performed either independently at home or under intermittent supervision with a physical therapist. Alternatively, there are injection treatments that can be considered and often provide more immediate relief of symptoms. I typically consider these if your pain is severe, you cannot sleep at night due to your shoulder, or you're just frustrated by the length of time you've been dealing with shoulder pain and dysfunction. Problems with the rotator cuff can range from just inflammation to a partial rotator cuff tear to complete full-thickness rotator cuff tears. Whereas non-operative treatment can work at times for all of these concerns, sometimes surgery is an option that should be considered. If surgery is considered, we will often get advanced imaging of the shoulder, such as an MRI, to further explore the extent of injury to the rotator cuff. When surgery is indicated, it is done on an outpatient basis, where you go home the same day. It is done through tiny little arthroscopic incisions. Duration of sling use is determined by the extent of the rotator cuff injury and the procedures required. Earliest return to full activity on average is 3 to 5 months, again determined by the extent of injury and procedures required. So I hope you are not having shoulder pain and never develop it. But if you are concerned about persistent or severe shoulder pain and you would like my help in solving it, please contact me, Keith Baumgarten, at the Orthopedic Institute, where I'll help get you pain-free.